got this
All right.
on my leg.
Yeah.
Now, this is the 3rd or 4th time it's come up. I've had steroid cream. I've had penicillin antibiotics.
Yeah.
It started off as a bite or a sting on that spot there.
Right. When was that?
8 weeks ago.
Was it?
And it's coming up again. I finished the antibiotics last Thursday.
Yeah.
So it's a week, and it was fine, and now it's starting to flare again.
Just have a seat. I'm going to come and have a closer peer. So when you use the antibiotics, what happened?
It seemed to get better.
Right.
And then but like I say, it's flaring up again.
So when you use the antibiotics, it makes everything better?
Well, it did do. Yeah, no, it did, yeah.
Yeah. How many courses of antibiotics?
First of all, I put bite and sting cream on it. Then I had steroid cream from the doctors, and then a course of antibiotics.
OK. Do you get psoriasis at all?
No. I've never had psoriasis, although my mother is riddled with it.
Right, OK. Sometimes with psoriasis, if you are prone to it, and sometimes it occurs in a place where you've got an injury, a trauma.
OK.
And, of course, the bite and the infection may be enough to cause a patch of psoriasis. Sometimes bacterial infections with the commonest thing that causes skin infections called Staphylococcus. So have you heard of those bugs? No. Well, they cause skin infections really commonly. Okay. They can sometimes cause blistering. So it's a little bit of a mystery. I think what I'm going to suggest that we do is the antibiotics seem to work. I'm going to give you a higher dose and a longer course for 2 weeks, and then see what happens. But if it's not settling down, we'll see you again. And if it all goes away, then job's done. Yeah. Okay. All right.
Thanks
nice to see you.
Today.
Yeah, no problem. Nice to see you. Bye.
Bye.
Come on through, Jeffrey. So we had a chat about this yesterday.
Yes.
Saw you in November, December, when you had this sort of tightening of the foreskin.
That's right.
But you could get it back, and I referred and it got rejected.
Correct.
But since that time, it's got worse.
Definitely.
And what can you do? Can you retract it back to go for a wee or anything like that?
Not at all. There's no retraction at all. And it's getting a little bit embarrassing because obviously there's no direction.
So does your wee come out in a... Does it spray at all? Or?
Yeah.
Okay. Okay. And is there any skin change on the tip of the penis that you can see?
There's colour change.
There's a colour change.
Yeah.
And when did that develop?
Well, it's been developing since it hasn't been able to retract.
Yeah. Yeah. Okay. Sorry, Jeffrey. I just need to. Can you see what you can retract yourself?
Yeah, sure. There's nothing at all.
There's a whitish skin change there, though,
Yeah.
isn't there? Yeah, fine. OK. And let you pop your things on and get dressed. That's OK. I think you've dropped a couple of copper pennies there.
Oh.
Right. Well, obviously it needs sorting out. I think what's going on is something called BXO, which is a kind of skin condition that over time in your sort of age group leads to just the tightening of the foreskin, exactly the kind of symptoms you describe.
Yeah.
And so that needs acting on pretty quickly, actually. Haven't seen a case for a while, actually. BXO stands for balanitis erotica et obliterans, and it causes thickening of the foreskin and depigmentation. This presents with symptoms of poor stream when you're passing urine and pain during intercourse. It's relatively uncommon, we don't see it very often. Medical options are using steroid creams, which sometimes help, but unlikely in cases where they're occurring in older age groups. Usually the definitive treatment is surgery, which is often a circumcision procedure. Does it itch at all?
Every now and again, I get that really it itches inside.
Yeah.
And you can tell it's quite hard skin at the top end.
Try and keep the area dry. The other thing is just to book in for some blood tests. I just want to check your sugar level and a few other bits and pieces because you haven't never really had any blood tests.
No.
So if you take that along to the treatment room, they'll book you in.
Yes.
I'll speak and sort out the urology referral again.
Yes.
See what we can do, but it's more urgent now.
Yes.
Remind me, do you smoke at all?
No.
You've never smoked?
I gave up when I was 10.
You gave up when you were 10?
Yeah.
Should I ask how old you were when you started?
About 8.
Were you just trying it or smoking proper?
No. My friend and I used to go down to Central Park in Plymouth.
Right.
Because my dad was in the Navy, so there's 60 a day, so there's cigarettes everywhere.
It was freely available.
So we used to just go into the park with a packet of 10 and a bottle of lemonade.
Then muck around.
And then when I was 10, Steve decided to drag one down, and I thought, no, I didn't like that.
Didn't like it, so it put you off for life.
Yeah, definitely.
OK, well, there we go. All right, Jeffrey.
There's not too many people who say that.
No. I'll speak to you a bit later.
Brilliant.
All right, we'll get that sorted ASAP.
Lovely. Thanks very much for that. Brilliant.
Take care.
Thanks a lot.
Bye.
Hi, what are we talking about?
Right. Basically what it is, I'm finding my ankles in particular really difficult to deal with, especially my right leg. I don't know what this stuff is on my skin, but it seems to be pain, swelling.
How long's it been swollen like that for, then?
The last few months.
Is it in the ankle or is it in the leg?
It's right in the ankle.
Yeah, let's have a look at the other one.
Now, the other one is...
So what happened to this leg, then?
Oh, this... Oh, God. I had polio when I was a baby. I was one of the last ones to actually get it. And, caused paralysis from my knee downwards into my foot. And this is necrotizing fasciitis. Started off with a stinging in my knee.
Yeah.
Then after about 10 minutes, I started shaking and perspiring.
Yeah.
I read up on it, and there's a certain type of house spider which carries a bug.
So it's left you incredibly disfigured, hasn't it? With all that infection, and then presumably they did an operation on it?
Yeah, they had to take
You were lucky not to lose the leg?
Yeah, layer of skin from my bum.
Yeah.
It's such a nice bum before as well. Whatever.
It's this one that's the problem today?
My foot won't be very clean because...
That's all right, don't worry.
I can't get down.
That's all right, don't worry. This brown skin is called varicose eczema. And that's because of the varicose veins, the fluid leaks out, and that brings with it some iron. So some of the veins then leak, and the iron it gets deposited in the skin, and it can cause usually itching and brown staining, but it doesn't usually cause a lot of pain. Can you make the ankle go round at all?
I've got no movement in my toes whatsoever.
OK. So your legs have taken a fair battering, haven't they?
I can't wear a bikini anymore. It's stupid. It just get laughed at.
And you've had the heart done as well, haven't you? And I guess I'm just wanting to listen into that and listening to check your chest as well.
The brain's all right, by the way.
Good.
So far, anyway.
So I think that there are lots of things that are going on here.
Yeah.
One of them is that I think you've got this varicose eczema, and I can give you some steroid cream that will help in case any of this is linked to that rash that you've got.
Yeah.
It wouldn't particularly explain the leg swelling.
No.
And it's also that there may be some arthritis or some damage in the ankle on that side as well. So I'm going to get an X-ray of the ankle and just see what that's doing.
Right, OK.
In terms of the heart, that could be linked as well, because you've had the valve replaced. Sometimes if the heart isn't pumping very well, that might make some fluid collect in the ankles as well. So I'm going to get a blood test to check the heart and the kidneys and the liver, and I'm also going to do a chest X-ray to make sure there's no fluid collecting there. Now, when I listen, there isn't, so that's good news.
That's brilliant, OK.
How's that for a plan?
Yeah, that's fine. I've given up the cartwheeling. It's just ridiculous, you know. Anyway.
Listen, well, I'm glad that you're keeping in good spirits.
You've got to have a sense of humour, otherwise you just go absolutely...
Well, I think that's definitely true. That's definitely true.
OK, thank you very much. By the way, what's brown that runs around the garden? A fence. All right, see you later. Bye-bye.
OK, all right, you've been in the wars? Yeah. All right.
Good pronunciation.
Oh, was it? OK, yeah, oh, good, good. All right, good. That's good. Right, so you were in yesterday.
Yeah, I was in yesterday.
With toe problem.
Yeah.
And the doctor suggested you go and get it X-rayed. Have you had it X-rayed?
I went and they were really busy, and the bloke looked at me and had a look at it quick, and he said, "Oh, I'll just go and have a look at the X-ray you had 2 months ago." And he said, "Yeah, I can't see anything. You're gonna have to go back to your doctors."
OK, let me have a little look then, just to try and see what's going on. It was 2 months ago.
Yeah.
You were playing American football, fell over, landed on your big toe. But you had an X-ray at the time, and you were told, OK, still unable to run or put weight through toe. Is a PE teacher, so affecting work, obviously. Dr. McLaren examined you yesterday. He thought it all looked normal, and he suggested re-X-ray to confirm no missed fracture. OK. Let's have a look.
Yeah.
OK, all right. Which foot are we talking about? Your right foot.
One, yeah.
OK, all right then. OK, if you want to hop up there and have a look. So this is now, we've just agreed, it is 6 weeks, yeah? That's just important because a soft tissue injury, my pat line is 4 to 6 weeks. And you're not quite at that yet. OK? Now, I don't know if you've been resting it.
I have, yeah.
OK, so whereabouts now is the pain?
If I press in here, it's like excruciating, right underneath there.
OK. I'm not pressing hard enough, or is that...
It's like where you had it there, like underneath.
Just under here, yeah. So it's a little bit warm, it's a little bit swollen. OK. So how long did you take anti-inflammatories for?
Probably the first couple of days.
OK. Right, well, I agree with you, it's a little bit warm, and it's a little bit red, and it's obviously still sore. So you get your things back on, and let's have a think about what we're going to do. OK. OK. Right, so you put your...
It's just one of these things, because sports is my life, and, like, I'm sitting at home feeling like I'm getting fat, I'm getting, like, depressed over it, and I can't, like...
OK. First thing, is that, 4 to 6 weeks, you're not quite at that yet, OK? So what I would do now is take anti-inflammatories and then book in to see Dr. McLaren in a routine appointment for maybe 10 days, 2 weeks' time.
OK.
See if it's improving.
OK.
And then we can take it from there. OK?
No problem.
Is that all right?
Yeah.
Sorry. I'm sure you get through.
Right.
I'm sure you'll get there.
Yeah.
OK? Don't run before you can walk, literally.
Yeah.
OK?
Thank you so much.
OK, all right then. I hope it settles down soon.
Yeah,
all right,
thank you.
bye-bye.
Bye-bye.
Come on in, come and take a seat. So I think, Ilaria, your English seemed fine last time, didn't it? Do you feel that we need to get an Italian interpreter? It's okay, isn't it?
Yeah,
really?
I want to try. I need to learn English.
Yeah. So all your blood tests are looking fine. And has this lump that you felt here...
I have a small, but not like last time when I came here.
I'll have another feel now, if that's okay. Is it all right if you just pop your jacket off there? So I'm just going to have a...
Yeah, it's fine.
I mean, I felt all of this last time, and that whatever it was, I can't feel anything now.
Yeah.
Everything feels totally normal. Yeah, OK. Was there anything else you wanted to ask me today?
I have anxiety. I feel like panic. I'm too emotional. I feel depressed. I don't sleep well. But I don't want to take any tablets.
And when did you come here from Italy?
I came in 2015.
OK. Are you settled in a job here, or are you looking for a job?
I was working, but I look for a new job now. Tomorrow I get the appointment in job center.
Good, OK, so you're looking at the job side of things. Yeah. And how many flatmates or housemates do you live with?
5.
5,
yes.
OK. And do you have a partner in your life at all or not?
No, I was in a relationship. I had a bad relationship. And, I don't trust, to be honest, I don't trust in love.
OK. So you're carefree and single at the moment?
Yeah.
And no sort of, with you when you were younger or now, no risk of kind of self-harming?
No.
No, it's more anxiety.
Yeah.
I think you're right that we don't need tablets to help with that kind of thing unless it's something that's so persistent and you can't get out of bed and that you're not functioning.
I think too much. I always...
Yeah. But what might help is perhaps looking into ways of managing the anxiety better or improving the anxiety symptoms, OK?
Okay.
So there's a service here called Bristol Wellbeing Therapies. I'll just give you a leaflet about it. They can talk to you about anxiety, how to manage the symptoms better. Because we all have some traits, don't we? Some of us worry more, others are different. So if you know that and it can help you a little bit, it might be helpful. And how do you feel about that?
Good.
Yeah? And then you're working positively to that. You're going to the job centre tomorrow.
Yeah.
Your blood tests are fine, not worried about your physical health. OK. And
I like always check up about my, like a little bit hypochondriac.
OK, about the health
because
side of
when my
things.
mama, she had cancer, when my granddad daddy had cancer, I feel more apprehensive.
Yes, worried
So I want to check everything, it's all right.
So I think physically, not to worry. If there's any symptoms, you can come back and talk to me or talk to us. OK.
OK, thank you very much.
That's
Lovely
all right.
to speak with you. I like.
No problem. Pleasure. Nice to see you.
Thank you very much.
That's all right. Nice to see you. Take care. Good luck with all the job things tomorrow.
Thank you. Thank you. Lovely. Have a nice day.
Bye-bye.
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right, and how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No. No. Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's OK?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding? You don't get any bleeding anywhere else?
No, nothing.
No other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area, which is the place that you get nosebleeds from, that's got a little bit of a crust over it. And that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them, because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and of course she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, OK? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here.
Nose.
Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight, and then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right? And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers,
Lovely,
then.
thank you.
Bye.
Bye.
Come and have a seat here, if that's all right. It's a little bit sort of crammed. Is that all right? What can I do for you?
So basically, I have a IUD inserted. It's been in for about 2 years, but I've been getting really bad cramps and pain when I'm having sex. I can feel it in the top of my cervix, and my period's been ongoing for about 2 months now. So it was about a week ago that I started feeling pain. There.
Okay. What I wonder is, has it moved?
Yeah.
Has it come down a bit? Do you feel like it might have done? Is that what you had in mind? Anyway?
Yeah, because I'm not sure what else could I'm normally really regular with my period.
So what I'm going to do is see if it's sitting down in the neck of the womb.
Okay, sure.
Not terribly pleasant, but it's not terrible. So I'm going to get you over lying on here, and you're going to need to take all your bottom things off, I'm afraid. But it's warm today, so that's not
it's
not a freezing day. So what I've got is the speculum, you know that
thing they used to put it in,
and I've also got some swabs, because sometimes funny bleeding can be caused by an infection.
Yeah, okay.
So I'll just check you for chlamydia whilst we're about it. Yeah. And if there's any discharge, I'll take this swab as well. So it's a couple of swabs. Oh, so bend your knees up for me. Is that all right? First thing I'm going to do is I'm just going to feel the womb and see how everything is in there. That's all. OK. How's that? Yeah, sorry. You can get up and... You're all right?
Yeah.
Very good. If you like to get up and get dressed... So, 2 possibilities, well, 3 actually, I suppose, that we have to think about.
Okay.
One is that you got pregnant. I don't think this is likely to be the case with the coil in, and it's causing funny bleeding. So I think we should do a pregnancy test.
Okay.
The next is that the coil has slipped.
Yeah.
And that actually we'll have to take it out. And then the third is that you've picked up an infection of some sort that's causing it all to be sore.
Okay.
The question is really, are you sexually active?
Yeah.
Because if you are and not using condoms, that is always a possibility.
I've had the same boyfriend for like more than a year now.
Yeah, so it's very unlikely.
Yeah.
The coil's a good option for Melissa because once it's fitted, it's sitting there doing its work without Melissa having to do anything about it. And this makes it much safer than other sorts of contraception, such as the pill that you have to remember to take every day, because however good you are at that, sometimes you're going to forget. The coil might not be for everyone. For example, if you have more than one sexual partner, you will be exposed to sexually transmitted diseases, and the coil can transmit those diseases up inside the uterus and into the tubes and increase your risks at a later date of infertility or of pelvic inflammatory disease. And then we're going to need to see you again in a couple of days' time, probably. Is that all right?
Yeah, no, of course.
So come in and have a seat.
Thank you.
Yeah, so I'm Dr. Lee now.
Hi. So I came off my bike last week.
Oh,
as
yes.
you can probably tell.
Yeah.
So I was taken to Southmead. They did lots of X-rays and everything. Nothing's broken, which is good. But my shoulder has given me quite a lot of pain. They said there's nothing wrong with it. There's no break. But as you can see, the bone is in a funny place. And it's just really painful.
Can we just put your hair back?
Can't reach very far with both hands. My chest is really painful.
Is this a push bike you were on?
Yeah.
Wow.
It's really tender.
Can you move that up?
I can move it holding it, but I can't move it on its own. So that's quite painful there.
Can you come across your chest?
With help, I can.
Again, yeah, but
Yeah,
okay.
not on my own.
And I'm not even going to attempt to put your arm behind you.
No, I can't put it. I can't sort of put a cardigan on or.
But it looks to me as if the shoulder is dropped right down. So I'm sure. Did it look like that when you came out?
Well, I was laying down.
I suppose you were a bit out of it.
I was laying down the whole time I was there. So I'm wondering if they actually realised it was looking like that.
Neck sprain.
They didn't say that to me.
Oh. I think they completely missed it, actually. I mean, I presume that because the clavicle isn't fractured, because the collarbone is not fractured.
Yeah.
They've obviously. Are you all right to go down?
Yeah, I just. Oh. So I'm wondering, because I was like this the whole few hours I was there, if they actually.
Yeah. Okay. Well, you poor thing. So I think obviously you're going to need to go to the fracture clinic. Are you all right? Can you help?
I just need a bit of help. Thanks. Thank you.
What about your face? How's that?
It's fine, yeah.
Is it?
I know it doesn't look it, but it is.
Bikes are so fabulous and so dangerous when you come off, aren't they?
I know. I went back to see where we came off today. We measured it and we reckon I travelled about 100 feet from where I left the bike to where I landed.
How did you come off?
The chap in front of me came off in a pothole and I was right behind him. Yeah.
Really difficult. Let me
So we'll have to wait a long time for this?
No, they run them every day, actually, so I'm hoping we can get you up tomorrow. Let's see. Yes, hello, it's Dr. Liz Lee here. I'm a GP at Hawford. I've got a patient who needs to come to the fracture clinic tomorrow, please. That's marvellous. Thanks very much indeed. Great, bye.
Brilliant, thank you.
Well, that's good. So what did they put on your sick note, actually? Shoulder injury or...
Oh, I'm not sure.
Well, I'll put shoulder injury because that's the thing now. And if I give you 14 days, because I think it's going to take a little while, isn't it, this? So that's 2 weeks.
Brilliant, thank you.
It's gone, but you better wait and see.
Thank you
Well,
very
you poor
much.
thing.
All right, thanks.
Okay, okay. Bye-bye.
Come on in.
Thank you.
Have a seat. How can I help?
It's my right kneecap.
Okay.
I'm all right doing long walks, but when I stop, it seizes up.
Right.
And I have to let it rest for a while before I can... And if I start walking it straight away, it hurts.
Yeah.
I can kneel down on this knee, but I can't put this knee down properly.
No. Can we have a look at your knees? Do you want to just pull up? And could you do that with the other one as well, just so I can compare them? That's it. You can see that it's a bit swollen up there, can't you? And if I just have a press round that side, that's okay?
Yeah, it's fine.
Round here? Does it actually hurt if I press there?
No.
Okay. And if you fully straighten it, does that hurt? No? Bend it? Straighten it? Well, that's pretty good, isn't it? And if you just move your knee just so that your ankle's there, yeah. And I'll just give it a bit of a test. It's quite stable, isn't it? Yeah, good. OK, you put your trousers back down then. Your knee is taking quite a lot of weight at the moment because it's the main joint that carries you around. Have you had thoughts about losing quite a bit of weight at all? Any thoughts about I mean, I think it would really help with what you're here for today.
Think about trying the Weetabix diet.
The Weetabix diet? So what's that one?
Just Weetabix 3 times a day and that's it. And
Really?
then you play with your fruit.
Right. Sounds a bit crazy to me. What do you think about it, really, the Weetabix diet?
I think it's all right.
Yeah? I mean, do you know how people successfully lose weight?
Well, you've got to mix the exercise and the healthy eating sides.
Most of losing weight is simply eating less. So I actually say that most people who successfully lose weight just say, I'm going to change the way I'm going to eat for the rest of my life. Because a lot of people do these diets, like a Weetabix diet, and unfortunately, when they go back to what they normally do, they just put the weight back on. So sometimes I suggest to people they just reduce the quantity, because quite often, quite a lot of us are eating more than we need to.
I have breakfast. Sometimes I have lunch.
Yeah.
But I do have for dinner.
Yeah. People who eat breakfast are in general thinner than people who don't. And people who eat a small regular meal 3 times a day are lighter than people who don't do that. Your body sort of needs regular eating. We all eat our main meal in the evening in this country. And the problem with that is that we're having a lot of calories and then we go to bed. And actually, when we need the calories is the morning and the lunch, and much less in the evenings. If there's any way that you can change that around and have your main meal at lunchtime, that's supposed to be healthier.
OK.
If you wanted some more help about losing weight, then you could book maybe to see one of the practice nurses or something along those lines.
OK.
Is that all right?
Yeah.
OK.
Thank you for that.
That's all right. Nice to see you.
Nice to see you.
Bye now.
Bye-bye.
Thank you.
Come and have a seat.
I've got like a sort of tremor in my left arm.
Yeah.
I've had for years.
Yeah.
And it started seemingly getting a bit worse. So I just went out for food the other day, and when I was sort of trying to eat, it's a little bit now. When I was trying to eat, it was really starting to shake quite a bit.
Okay.
Sometimes, like, it's absolutely fine.
Yep.
But other times, I can't really put my finger on what it is that makes it happen. I think it might be possibly tiredness, maybe.
So you're 29 now. When did you first notice it?
I generally think I've had it for quite a few years.
Yeah.
I think, but it was so minor, I never really thought anything of it. But I think it's getting a bit worse.
You think it's a little bit worse? And what sort of work do you do?
I'm a physio.
Okay, OK. So what do you think?
Yeah, I know. So I'm trying to diagnose it myself, yeah.
Yeah.
One of the reasons getting it checked is my mum's got MS.
Right.
I've got no other symptoms, but I just thought it'd probably worth flagging out.
Yes. Do you want to just put your arms out like that for me? You have got this. It feels like you've got a fine tremor in both.
Yeah.
But it's more obvious on that side.
This is what it is always like.
Yeah.
But sometimes it really... The other day I was trying to eat some food and it was really like that. And I had to
Yes.
sort of put this hand down and...
Yes.
It's really noticeable. I do have a shoulder problem on my left side, that's the only thing.
Right. The other things in my head of tremor can be from thyroid disorder. We should probably do some bloods and just check that.
Okay.
Can I get you to just do me 1 or 2 little things just to look at the cerebellar function? So hand like this. Okay, and now a bit faster. Okay, and then let's do it the other way around. So that hand down that one. Okay. Great. Okay. Next thing I want you to do is to touch your nose and touch my finger. Touch your nose, touch my finger.
Just I can feel it shaking a bit when I do that. Yeah, that's bringing it on, you know.
Okay.
It's like a sort of juddery.
Yeah. Okay. So that does seem to sort of exaggerate it.
Yeah.
Okay. Let's see you do that with that one.
I'd say very slightly, but yeah, doesn't seem.
Okay. Okay.
But that's definitely brought. That's what it feels like.
That's what it feels like.
When it goes,
Okay.
yeah.
Okay. And you don't experience that in your legs.
No, not that I've ever noticed.
Your main worry is around MS?
I wouldn't even say worry, to
No.
be honest. There's just slightly increased chances.
Yeah.
I thought I'd bring it up. So
Yeah.
So if anything happens in the future, we can sort of say, right, OK, well, it started then.
So if we get some bloods done, and then to think about whether we want to ask neurology to see you just to check it out, do you think that you would favour that?
Yeah, that sounds like a plan.
OK. Then why don't I just do both those things? And then, as you say, it'll sort of lay it to rest, won't it?
Yeah.
Great.
Will do.
OK,
Fine.
great.
Thank you very
Nice
much.
to meet you.
See you.
Bye then.
Come and take a seat. How are you?
Extremely tired. I'm exhausted all the time. I don't know what's going on, but the right side of my skull is changing continuously. It's getting big bumps, big dips, hurts like hell. I have no idea what's going on. I haven't banged it or anything, but it's completely deformed. There's not an inch that is smooth. And it hurts. Touch it and I scream sometimes.
Okay. How long has this been with you for?
Months.
Okay.
It's months. Yeah.
Let's just have a look and see what's going on.
Yeah.
Have you found any bits that are itchy or any particular spots?
But they change continuously. Every day there's a new, and it's not like swelling because it's really hard. It just feels like the skull itself has gone over.
Well, there's nothing to be concerned about in the sense that there's no skin lesions or scalp lesions because some people get cysts or other things or spots or
oh no, it's a very
something or
different kind of pain than the cysts.
But I mean, it all feels like a normal. It feels normal to me.
Really. And this really gets me, especially in the evening. It starts to hurt, and I'll just brush my head or just touch my head, and I'm just like shocked at the amount of pain that there is. And I start touching, and I find all these painful spots.
So it might be what we call dysesthesia, or it's an altered sensation.
Yeah.
It's almost perhaps some kind of superficial nerve thing going on. But I think we'll just watch that. George is currently 59. He has quite a few complex medical health problems. He suffers from cluster headaches. He's hepatitis C positive and HIV positive. HIV, if it's caught early, is no longer a death sentence. In fact, people can live a near normal lifespan because there have been significant advances in the medicines used to control the rate of growth of the virus. I'm pleased to say that currently George doesn't suffer from any issues related to his HIV. It's well controlled. However, unfortunately, he has also been under significant stress recently, which has led to anxiety and low mood symptoms.
I didn't take the antidepressants at all.
Okay.
I made a conscious decision that because they take so long to work, and there's certain things that, they basically castrate you. I mean, your sex life just disappears. And that is one of the only things that actually keeps me alive and happy a little bit. And to eliminate that would be just dramatically wrong.
If you're happy not to start that, that's fine.
I need my faculties, and I actually need a little bit of extra emotion to get through something instead of just kind of letting everything just, which is what happens a lot of times.
That's quite a valid point, actually, because sometimes some people can feel a little bit subdued on them.
Yeah.
You're not vomiting? You're not waking up at night with headaches?
Not those headaches, no.
No. And no symptoms on your face or in your jaw or in your mouth?
No.
Okay.
No.
All right. Well, you're going to be due some tests and things when you go to the Brecon unit next week, but maybe we could touch base in 6 weeks or so, and you can keep me posted.
Yeah.
Obviously, if anything bothers you before that,
Yeah,
then
sure.
come in sooner.
Sure. That's it, yeah. Good.
Nice to see you.
Likewise.
Take care.
You too. Enjoy the weather while it lasts.